Good morning. It's February 18, 2025. I'm Dr. Duke Majan. Our patient travels from Virginia with back pain, leg pain. He has 3 different diagnoses causing it: disc, facet, piriformis. We're going to fix all 3 today. We're going to start with his disc. He has a massive herniation at L5-S1. We're going to do our best to get there and take it out. Are you ready, Dr. B? Yes. We're going to get started by placing a needle down to L5-S1. Can do a little numbing, but it's not going to be enough. He needs to be a bit more sedated. All right. If you have questions, feel free to ask. Shot. And right now we're just giving our patient some numbing medicine, getting him more comfortable so we can do the procedure. We're going to start with the Duke laser disc repair. Henry, let's show the audience the 30 different causes of lower back pain.
Of course.
I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. All right, welcome back. Our patient has a big herniation and tear shot in the L5-S1. Hold on. Disc shot. Okay. He's got a really big herniation medially, which is towards the midline. Very difficult to get to. And I told him it doesn't matter what surgery we do, laminectomy, microdiscectomy, endoscopic, we're never going to get all that herniation out. The question is, will we get enough out to get rid of his symptoms? That's our goal. So a lot of people don't understand that about spine surgery. They think the goal is to get all the herniation out. It's not. It's to get rid of the patient's symptoms permanently with one surgery. And this surgery you're watching right now is the very best. Transforaminal endoscopic Duke laser disc repair. Any questions?
Yes, we have a question. Just came up from Charlie on YouTube. Asking, when you enter the disc transforaminally versus anteriorly for cervical, is one entering the opening of the tear and one anterior moving toward the tear?
Yes, that is correct. That's correct. So in the cervical spine, oh, look at that. Beautiful, guys. Look at the pink tissue. That is inflammatory tissue. Should not be here. What we should be seeing is pure white. Normal disc, pure white. This has blue and pink. Blue is degenerated nucleus pulposus from the herniation, and the pink is inflammatory tissue. So, yeah, so when you go to the cervical spine, you're going to go through the anterior annulus with the dilator. That's why it's a small dilator. It's only 4 millimeters. The dilator is 2.8 millimeters. The actual tube is 4 millimeters. So you're actually not making a hole in the disc. You're just spreading the fibers of the annulus apart. And when you take the tube and dilator out, the fibers come back together. Just like putting a pin in your shirt. All right, good question. So we are in the L5-S1 disc. You can see on the MRI at the bottom corner, there's a massive herniation here. And we're going to do our best to get as much of it out as we can. I think on average, we typically get about 50-60% of the herniation out. It doesn't matter what type of surgery you do, whether you go through the front, the back, this back side. You're never going to get 100% of the herniation. It's impossible. Herniations cannot be 100% removed. It doesn't matter what surgeon, what technique. The goal is to get enough out that the patient's symptoms go away. And that's what we're going to do today. We're going to try our best to get as much out as we can so that his symptoms go away permanently. All right, Henry, if there's no questions, we can show the audience how disc injuries cause so much pain for patients in their back and in their leg at times.
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A quarter-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from the video that all disc problems start with a tear in the wall called an annular tear, and right next to the tear there's the same trauma that caused the tear also crushes the nucleus pulposus next to the wall. It fragments it into small pieces, and this is all scar tissue, by the way. Look at these strings right here that I'm zapping with the laser. You guys see those little fine strings down there?
Yes, we do.
Yep, there's one that just got released. That's all scar tissue. That shouldn't be there. That's caused by the herniation in the tear, causing inflammation. Inflammation over time makes scar tissue and calcification. All right, stand by. We're going to go in and try to grab out some of these chunks of material. Any questions?
Yes, we have a question coming from Lanu on YouTube,
All right, Lanu.
asking, what's your view about people wearing back braces?
Normally, I am against people wearing back braces because back braces cause the muscles in the lower back to get weak and atrophied. So I never recommend a back brace unless the patient has had surgery and needs the back brace during the recovery from surgery, or if they have a fracture, like a fracture of the bone that needs to heal, like a compression fracture. And then we put people in braces so those fractures heal. All right, great question. We're going to keep going. There's some more inflammatory tissue. You see the pink stuff? That's where the pain comes from.
Yes, we do. At this moment, no current questions.
All right. In that case, let us share with our audience the next treatment we're doing, which is the facets.
Of course.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see that facets can be a cause of back pain, and there's now a way to permanently fix facet pain at Duke Spine Institute. It's called the Duke Plasma Rhizotomy. All right. I am literally grabbing away and trying to pull out as many pieces of herniation as I can. I'm just getting a bunch of little pieces. I can't get a big one. We rarely get the big one. Usually herniations are made up of a bunch of small pieces that are scarred down to the annulus and disc. Very hard to get out. That's why we use the laser. The laser is the best tool for removing. You saw me use the grabbers over and over again. I couldn't get these things out because they're stuck down. This is all herniation right here. I'm at the base of the herniation. Just trying to remove it as much as I can. I'm freeing up the edges of the herniation, scarred down from chronic inflammation. Lots of little pieces. The laser is very effective at removing these pieces of herniation. Any questions?
Yes, we have a question coming from Charlie once more on YouTube,
Hi, Charlie.
asking if one has both cervical related symptoms, neck, shoulder, arm pain, numbness, and lumbar related pain, like back pain, leg, foot numbness, which is more concerning and more of a priority? Can one cause both symptoms?
Yeah, so no, cervical problems don't cause lumbar issues, and lumbar problems don't cause cervical. The priority is going to be whichever one has more nerve damage. Okay, nerve damage. All right, we are at the back of the disc. So if the cervical issue has associated myelopathy or cervical radiculopathy, where there's nerve damage happening from the disc problem or stenosis, then that becomes important to fix right away. On the other hand, same thing holds true for lumbar. If the lumbar herniation is causing drop foot, nerve damage in the nerves to the leg, then you want to address that first. All right, you can see I'm removing all the little pieces of herniation. We are at the outer margin of the disc, annulus. I'm just cleaning the edges. There's still a fair amount of herniation left. I'm going to do my best to get it all out. Remember, we never get 100% of the herniation. Not just me, but any surgeon, it's not possible. So any time you get an MRI scan done after the surgery, you're still going to see herniated disc. The question is, how much can you get out?
We have a question
Sure.
coming from Faisal on Facebook.
Yes, of course.
Saying, Doctor, this is where you shine and other surgeons fall, sort of address pain. Nerves can be irritated and cause pain even without a pinched nerve or disc herniation, as inflammatory substances leaking from a tear in the annulus fibrosis can irritate nearby nerves and inflammation.
Correct.
Nerve inflammation, neuritis, can irritate nerves, potentially leading to pain and other
That's right.
symptoms.
That's right. You're right, Faisal. You're 100% right. That is what other surgeons miss. They miss the fact that most pain comes from chemical irritation of nerves rather than compression, big compression. All these doctors are looking for a big herniation to explain the patient's symptoms. But the big herniation is not the cause. Compression is not the cause. It's inflammation that's the cause. Chemical mediators being released from the inflammatory process within the tear and just outside the tear that spread to the nerve fibers and cause basically irritation of the pain nerve fibers, which are free nerve fibers, type C or 4, type 4 nerve fibers. They're free nerve endings. And that's what mediates pain. And there's lots of them in the back of the disc right here. And the more inflammation there is, the more pain fibers there are. All right, these are all pieces of herniation. I'm literally pulling the base of the herniation right here. I'm grabbing the bottom of the herniation and pulling it. Oh, there's a piece right there. Look at that. That's a nice one. Okay, but it's not the whole herniation. Okay? Unfortunately, it's in pieces. And that's because this patient's herniation, oh, there's another piece. It wasn't one herniation. It didn't happen at one time. It happened over multiple herniations, over years. And little pieces kept coming out. And so all these little pieces are individuals. It's like opening an elevator and finding 20 people, 30 people in the elevator, not one person. And then you got to get all 20 people out of the elevator. You see how I have to grab and pull. That's because these pieces of herniation are stuck. They're literally stuck down. Okay? Some of them are free, but many of them are stuck to the walls of the back of the disc, the tear, where they came out of. You understand? They're scarred there because there's lots of inflammation over the years scarring them here. Almost done. Another piece. I think we're making pretty good progress. Any more questions?
No current questions, but we do have a comment coming from Charlie once more on YouTube saying, you mentioned many surgeons don't deal with pain. It's frustrating when you hurt, but you don't present with strength, etc., issues in an evaluation. Talking about surgeons in general.
Yeah, the problem is pain is ooh, there's a nice piece of herniation right there. Look at that. Let's show the audience. It's not a great one, but it's a good one. It's okay. You guys see that?
Yes, we do.
Pretty good. But
yeah,
you can see it's pieces, okay? Almost done. The problem is, what I've learned over the years, curing pain is a surgical fix. You need to do surgery to cure it. That's what I discovered, okay? But surgeons don't treat pain. They believe pain should be managed by pain management doctors because surgeons don't know how to cure pain. They don't know what to do to cure the pain. So they recommend pain management. Pain management doctors can't cure the pain because they don't know where it's coming from most of the time, and they're not surgeons, so they can't do surgery to fix it. So it's just a cultural problem. We have a cultural issue. It's an issue with shared beliefs in the medical community. Surgeons believe pain can't be fixed. Pain management doctors don't want to fix pain and can't fix pain because if they cure the pain, then the patients stop coming back. They stop making money. They went into pain management to manage pain. That's what the field is called, pain management. It's either medical pain management or interventional pain management. That's literally the name of the field and specialty, pain management. I am a pain management doctor, they say. Well, if you're a pain management doctor, you manage pain, you don't cure it. You understand? So they're of the mindset to just manage pain, not cure it. And surgeons don't know how to cure it, so they don't want to deal with people in pain. calling them all the time asking for pain pills. So they tell them to go to a pain management doctor, and they refer them. That system is broken. I can fix it, but I need the ability to fix it, which means I have to have a connection to our federal government to basically impose regulations that would allow us to cure pain. Yes, B. Everything okay? All right. So I'm just whittling away at this herniation. We're literally looking at the base. I'm going to try to get a little more medial as I can, safely, towards that big piece in the middle. I'm working in between the bones. You guys see the bones there? Little bone spur right here. There's some more herniation there. I got 5 minutes on the herniation.
We have a question.
And as I remove more of this herniation right here, like the base of it, more of the herniation, the part that's sticking out back is pushing back into the disc space. So it's delivering itself like a baby coming down the birth canal. Okay? First the legs, then the head, or then the torso, and then the head. Or is it the other way around? Head first. I was describing a breach. My dad was an OB-GYN. He would be very disappointed in me, but I didn't like OB-GYN in med school. I didn't really care much for it. My father loved OB-GYN, said it was the best field in medicine. That was back in the 70s and 80s, 60s, 70s, 80s. Back then it was a great field. Now it's changed a lot. All right, there's still herniation there. You guys see it. I'm going to try to grab some more of that. And you have a question?
Yes, coming from Lanu once more on YouTube. Asking, insurance and pharmaceutical companies send their lobbyists to Washington.
Oh, we got it. Look at this, guys.
Oh, wow.
Look at that. There it is.
Yep.
That's the piece. Here. Oh, yeah. Oh, yeah. Yep. Nice.
Wow. That's
All
incredible.
Right. We're going to go look and see if there's any more. But that is the blow for freedom right there. We just basically got rid of his back and leg pain. That doesn't mean that's everything. There may still be some more pieces. I'm going to go look. So, sorry. Insurance companies, pharmaceutical companies, lobbyists?
Yes, insurance and pharmaceutical companies send their lobbyists to Washington to influence the politician. As a result, the policy is altered favoring them and not the patient.
That's right.
Is this the root cause problem?
Yes, it is the root cause problem. That is 90% of the problem in America with healthcare, why our healthcare has fallen apart, is the insurance companies are writing the laws that benefit them and not the people. And specifically, the laws they're writing allow them to say no or deny. The Wall Street Journal published last week that a report, they found 850 million denials every year by the health insurance companies. That's not paying for medical care that's needed, that's ordered. 850 million. So people say, Dr. Duke, your surgery isn't covered by insurance. They deny it. Yeah, they deny, let's say 300 a year of my surgeries, laser on. But they deny that 300 a year denial for my surgery is nothing compared to 850 million other treatments denied every year. Right? So the problem is bigger than the Duke laser disc repair being denied. The problem is 850 million denials a year by our insurance companies. And what allows them to do that is the laws. They have rewritten the laws. And they've done it quietly, sneakily, so the American people don't know what's happening. They've rewritten these laws. And our politicians should be ashamed of themselves for allowing it. But the problem is these laws that they write are too complicated for our politicians to understand. So what they do is the lobbyists will get lawyers to write these laws. They bring them to Washington, D.C., and they tell the senators to vote for these. And the senator says, I don't know, what am I voting for? And they say, don't worry about it. We're going to get you reelected next term. We're going to give you money so you can be reelected. And the senator says, that sounds good to me. Also, we're going to give your sister $1 million contract, so she can give some of that money back to you, in money bags. And that's how our government works. And of course, Trump is trying to change that and clean it up. But there's so much corruption in our government. Politicians voting for things to be made law that the insurance companies want, the tobacco companies want, the pharmaceutical companies want. Meanwhile, it's hurting Americans. And Americans don't have a lobbyist. The American people don't have a lobbyist in Washington, D.C. They're supposed to have politicians who represent them, but that's not happening. Okay? And that's why we're in this situation. Corruption at its finest. All right, we're just about done. I've gotten as much of this herniation as I can. I can't grab anymore. I don't feel anymore. I feel like we got a good amount. He should do very well. There's still more there, but I can't get any more. We're done. All right, any other questions?
Yes, one question coming from Faisal on Facebook, asking what kind of energy is laser using to tear through the targeted materials? Is it heat or electrical current?
Oh, it's a great question. Yeah, the laser uses electromagnetic radiation. That's what's coming out. It's electromagnetic radiation, which is basically same thing that light energy is, or microwaves, or infrared. It's basically wave-like energy, and it comes out of the end of that fiber, and then it disrupts by breaking up the bonds between proteins. It disrupts molecules into pieces. It also uses a sonic wave and cavitation. So it's two things. It delivers electromagnetic radiation directly to tissue, breaking up covalent bonds between biomolecules, and then it also creates a pressure wave in the water column that is like a pulse wave. All right, we're done with laser. We're going to end the stream. We're going to come back for facet joint Duke plasma rhizotomy.